Welcome everyone, and thank you for joining us for tonight's Post-Weight Loss Refinement Webinar. This event is designed to give you clear, trusted guidance on what comes next after significant weight loss. We'll be covering both non-surgical and surgical options, and our overall goal really is to help you understand what's possible, what's realistic, and what an individualized treatment plan can look like for you. We're fortunate to have three of our specialists with us tonight. Dr. Melissa Michelon, board-certified dermatologist who focuses on skin health, energy-based treatments, and non-surgical solutions to improve tone, texture, and elasticity. Then we have Dr. Sean Doherty, board-certified plastic surgeon, who will lead the discussion on post-weight loss body procedures, focusing on contouring, tightening, and restoring balance after major changes in weight. And then we have Dr. Vickram Tandon, board-certified plastic surgeon, who will walk through post-weight loss breast and facial treatments. He will highlight how to restore youthful shape, structure, and definition in these areas. So each will share their approach and explain their treatment options and review real patient examples. And after the presentations, we'll open the floor to some questions. Dr. Michelon, board-certified dermatologist. So whenever you're ready, Dr. Michelon, take it away.
Hi, everyone. Thank you for joining, and thank you for having me. A lot of our patients are coming in having used the weight loss medications like the GLP-1 agonists. They're increasingly popular recently, and when taken, they can lead to a significant and often rapid weight loss. While we find that patients are healthier, happier, they're fitting in their clothes better, there can be some unintended changes with those medications and weight loss. And sometimes it can be frustrating to have lost all that weight and then have alterations to things like their facial appearance. So we'll talk about some common concerns that I see as a dermatologist in our practice. The number one thing is probably volume loss. Patients are seeing volume loss everywhere, but especially in their face with rapid weight loss. It can be anywhere, temples, cheeks are a big one, under the eyes, and jowls and marionette lines become more obvious on the lower face. You see changes in the fat pads and also in the subcutaneous fat with weight loss, and this can affect contour and balance of your facial features. Patients are noticing a decline in the quality of their skin. With the weight loss and volume loss, it can lead to skin sagging, crepiness of the skin, and especially if the weight loss is rapid, the skin doesn't have time to adjust to those quick changes. Also with age, the collagen and elastin production in our skin naturally declines, and so changes in the skin quality can be more pronounced in our older patients. Fine lines and deeper folds become more pronounced with weight loss and volume loss. You see it, the marionettes are more prominent, platysmal bands are more enhanced. But also the appearance of the surface of the skin can change. A dullness or lack of hydration can be seen often with weight loss because it can have an impact on the function of the skin barrier and also overall hydration, and then that can lead to dry skin and the dull appearance of the skin. Stretch marks are also a common concern for patients who've experienced weight loss. Next, so some treatments and solutions and our approach in our practice. We will often take an individualized approach when treating patients and seeing them, because not everyone will experience their weight change and weight loss the same. They have different weight loss journeys and different after effects. And there's so many things that go into it. One's age when they start, their genetics, diet, lifestyle. And so there's not one treatment that can fix all of that. So combining treatments is what we will often do, and working in conjunction in a multidisciplinary approach with our surgical colleagues to find the best options available for the patients and the best treatment plan. talking about volume loss and volume restoration, and also hydration. In-office injectable treatments such as hyaluronic acid fillers are often used and can give an immediate volume restoration and recontouring on the face. We will use hyaluronic acid fillers to improve the surface hydration as well and the overall appearance of the skin. And then other injectables like polylactic acid can stimulate collagen and elastin production in the skin to increase the skin thickness, but also improve hydration and the overall glow to the skin. There are treatments available, energy-based treatments like laser and other devices that can help stimulate collagen production in the skin to induce remodeling and improve the quality of the surface of the skin and also texture. We can see improvement in fine lines, the crepiness of the skin. We also use these devices to help improve the appearance of stretch marks as well. Other energy-based devices like radiofrequency and ultrasound devices can also be used in some cases for modest improvement in the skin laxity. I also think it's important to take a holistic approach for treatment with significant weight loss. And looking at things like skincare, because good skincare can help support the overall health of your skin and appearance of your skin. And ingredients will do various things, such as retinoids, which will help stimulate that collagen production in the skin. Nutrition is also important. Maintaining a healthy diet along your weight loss journey, adequate hydration can also contribute to optimal healing and also your outcomes.
Right. Thank you, Dr. Michelon. Next, we have Sean Doherty. He's going to go over body treatments for us.
There we are. Okay. Thanks, everyone. Appreciate you joining tonight. And that was an awesome discussion on options for non-invasive things. And, you know, you're talking to two surgeons here ultimately. And so we like to talk about surgical options. And Danielle, maybe you want to go to the next slide.
Yep.
So as Dr. Michelon suggested, we're seeing a lot of people who are at various stages of this weight loss journey. It's really kind of what is so awesome about our job, that we get to see people at all these different stages. And whether weight loss is through diet and exercise, through hormonal changes, changes in life, or with the use of GLP-1 medicines, you do want to be at a fairly stable, sustainable weight if you are ultimately going to entertain something surgical. And so we really like you being at that place for 3 to 6 months before considering something, because we all know that weight can fluctuate, and you do want to be at a good place before your surgeon helps discuss the best and safest surgical options. For those people who are on GLP-1 medicines and do have a maintenance, and that tends to be a lot of patients that we see now, you do want to talk to your surgeon about the safe use of that during the surgical time. So in my practice, I have patients stop their GLP-1 medicines 2 weeks before surgery and really don't restart the medicines until about 2 weeks afterwards. The GLP-1 medicines successfully slow down the GI system, and we want your stomach to be empty at the time of surgery and not have any adverse effects of anesthesia. So that's the point of that. Then after surgery, we want you actually to be eating at sort of a fairly normal clip. We want nutrition that is necessary for healing. And so that's why I like my patients to wait about 2 weeks before starting that. But having said all that, what are kind of some options for surgical treatments for body changes? I would say the two most common areas that people are bothered by for female patients are breast and abdomen. And Dr. Tandon is going to talk about options for breast, so I'll focus on abdomen now. Abdomen has historically been a go-to place for concerns with aging, and then changes with volume loss really have a substantive effect on the abdomen. Loose skin, and really patients are at a point where they feel like they cannot do anything to change that. They may be at a good weight, they may be quite healthy, they have toned abdomen, but that loose skin is really unfortunately not going anywhere, and surgery is really the ideal solution for that. In terms of the abdomens, the a surgical plan is typically a combination of liposuction and excision of skin. It's done in the operating room. It can take between 3 to 5 hours to do something like that. It's a fairly substantial procedure, but it has quite amazing dividends. And I would say that's probably my #1 body contouring procedure that I perform. Liposuction is a big part of any body contouring treatment. And I think and I think others on the panel would agree, a lot of that people come to us hoping that liposuction will be the only kind of treatment that we recommend. And I would say when weight loss is part of the patient's presentation, simply removing fat with liposuction is not always going to get the best outcome because it's likely going to yield loose skin. But we always are using liposuction in conjunction with body contouring procedures, specifically an abdominoplasty. A lower body lift is a more substantive procedure and can affect more areas of the body. This is sort of, we call this a belt lipectomy, and it's an incision that goes from the front to the back, and it addresses loose skin in the abdomen. And this also addresses loose skin on the flanks and on the back. And this also can be a very impactful procedure for patients. A brachioplasty, also known as an arm lift, is also a quite impactful procedure. However, this is a little bit more of a challenging procedure for some patients to wrap their heads around, really because of the incision. So loose skin to the arms is ideally treated with excising that skin and its incision along from the armpit to the elbow. And as much as the improved contour is very satisfying to patients, the incision is a really big part of the decision-making process to go through the surgery. All right, let's go to the next slide. So thigh lift, I would say there are a lot of patients who are either weight loss patients or not weight loss patients that are concerned with their thighs, both the middle, as we say, medial or lateral, the outside. They typically like a combination of liposuction to debulk that area, and then a skin excision that is really towards the middle can help smooth out skin. In our practice, we like to use energy with these treatments, specifically a radio frequency, and that can help improve the remaining skin, help suggest even more skin tightening and get a better outcome, and sometimes can help even with cellulite. The back lift and a bra lift are for people who are bothered by the hanging skin of their upper back. Very often we combine something like that with a breast procedure. And so continuing incision from either a breast lift or a breast reduction to the back to help improve that area. That area is sometimes a place where liposuction can make somewhat of a difference to debulk some of the remaining fat there and smooth things out without necessarily needing an incision. And then lastly, we're talking about circumferential liposuction with skin tightening. So this goes back to kind of the procedure that everybody wants, which is just liposuction and not surgery. And I would say for some people it is helpful, but for most people in the weight loss world, it is really done in combination with surgery. Just a few caveats. If you're considering surgery, I wholly urge you to speak with a board-certified plastic surgeon, go in with an open mind, and just talk about the concerns that you have and be open to possibilities of procedures. I think when people have lost a tremendous amount of weight, there are a lot of places on their body that they want to address. I think having a priority list is very ideal because we don't always perform all of these procedures at the same time. So a staged process is a very safe and probably the best process to go through. So we have some pictures of mine. And so hope everyone realizes both men and women lose weight and are concerned by their skin. So this is a male patient of mine who lost a substantial amount of weight, and he was very much bothered by this hanging skin. And here you can see what an abdominoplasty did for him. And this is towards his back. So this is an example of a completion abdominoplasty, sort of a full body lift. You can see the incision that just above his undergarments, and it is all the way along the back. And this has substantially improved the contour and the loose skin on both the front and the back. this gentleman is extraordinarily happy. He did a lot of work to get to this, and he really deserved this procedure, and I'm quite thrilled for him. And here we have this lovely lady, also lost a substantial amount of weight. And I think it's pretty obvious what is concerning to her, this apron of skin. And so what I ended up doing, a combination of liposuction to the flanks and a traditional abdominoplasty. So it's an incision that's quite low and a small incision around the umbilicus. So she's probably about 3 months here and probably still healing. I would expect that umbilicus, the belly button incision, to soften up a little bit, but it really have improved her contour, and she just kind of feels like this is the body that she should have. So it's hugely satisfying to help patients on this journey. So recovering, this is a lot of stuff that no one wants to hear about. These procedures are quite big. They take a lot of time in the operating room, and we're working on a substantial portion of one's body, and it takes a long time to recover from this. And so swelling is a big part of that. And I tell patients that this change didn't happen overnight. To get to the point of being bothered by loose skin. And so the recovery is also not going to be an overnight process. So swelling is really substantial for the first 3 weeks. A compression garment is extraordinarily important, if not required, for this. After 3 weeks, I tend to change to a less aggressive compression garment, to more of a Spanx or a girdle or a performance wear, and to help improve that swelling. The big changes of swelling in all surgical areas to me are substantially improved at 3 weeks. At 3 months, I feel like people see about 75% of the results. And then at 6 months, I feel like this is where we're at. We can sort of see the final outcome. Scars, as I said, are fairly substantial. They're really part of the decision-making process to go through the surgical journey. Having an honest discussion with surgeons about what the scars are going to be, and then having an honest discussion about how the scars will anticipate it to heal. If you look at other scars in your body, you can see your tendency to maybe be thick and heavy or very thin and light, and that really parallels with these surgical procedures. Scars can take 12 to 24 months to really sort of mature. I think the benefit of working with a practice like ours is that we have lots of modalities to help with scar improvement. So energy-based treatments like IPL, fractional and non-fractional lasers, even microneedling can really help with the healing. And I would just say in general, starting those types of procedures very soon after a surgical procedure is their most effective. We talk about numbness in this incision. It's kind of the last statement here. Scars that we perform in these procedures are quite substantial, and it can take quite some time for sensation to come back, and it can take almost 12 months for sensation to come back.
Thank you, Dr. Doherty. Before we move on to Dr. Tandon, I'm not ignoring your Q&A and all your questions. I'm just going to wait till the end so we can get through these, and then maybe your question will be answered, or you might think of another. So we're just going to hold off. But next we have Dr. Tandon, board certified surgeon, who is going to go over the face and the breast. So whenever you're ready, Dr. Tandon.
All right. Thank you all for attending this webinar tonight. Before we even start to talk about the breast and the face, I do think Drs. Michelon and Doherty highlighted something that's very important, which is these changes following weight loss have happened head to toe at every body part, even down to the molecular level, the cellular level, where there's that elasticity of the skin that has been stretched and now has shrunk. Admittedly, it hasn't shrunk to the level that any of us want it to shrink, and that's why we have these surgical and non-surgical treatments. And I think to something that Dr. Doherty alluded to earlier is when you're talking to your surgeon, your dermatologist, is to have reasonable and appropriate expectations as well, because that elasticity is at every single cell layer. Even once we pull the skin tight, there's still going to be loose skin somewhere else. But another area of very popular concern is the breast. So as you can imagine, what happens? Well, a similar milieu of changes that you see elsewhere. You're losing volume because you're losing subcutaneous fat. So the breasts appear empty, particularly in the upper pole of the breast. They start to sag and droop more as that volume is lost. asymmetries can be further unmasked. When we talk about the changes in the nipple position, we talk about a phenomenon called ptosis, which is a sag of the breast. And as the nipples start to point more downwards as the weight is lost, that is something that is often very bothersome to patients. And then something I alluded to earlier, that stretched skin can lose elasticity, and so the breasts become long. So there's many solutions that are possible. I'll go through some of them here. The goal at the end of the day is going to be to restore shape and volume to the breast. Volume, of course, can be defined loosely. Some patients want to be a B cup, some a D cup, some a double D, and who knows. And that will also help guide which treatment is going to be best for you. So a mastopexy or a breast lift will reposition the breast and the nipple higher on the chest. I often combine this with a resorbable surgical mesh in patients who have lost a lot of weight. This is sometimes called colloquially an internal bra. The brand name that is most popular these days is Galaflex. The reason for that is, without the use of these meshes, you're relying on the skin to hold the new elevated position of the breast. And sometimes, if that skin has failed you once, I'll ask rhetorically, what's to keep it from sagging again? So anything to help it stay up higher can be used as an adjunct. Breast lifts with implants, also known as an augmentation mastopexy, are very popular. As you can imagine, they both lift the breast as well as add volume. So one of the keys when I talk to patients is, well, are you happy with the volume you have with a bra on? The answer is yes, you probably don't need the implant. The volume is there, it's just too low. But if you also feel like you want some more volume, we're going to need to add it. One way to add it is with an implant, and the other one pictured below is what's called an autologous fat transfer, which is where we do liposuction from other parts of your body. We take that fat, we process it, and we inject it into the breast in a special fashion. Now, not all of that fat survives. Admittedly, you only get maybe a half a cup to a cup size increase per round of fat transferred to the breast. And lastly, for patients who have had a history of breast augmentation, who have implants, often there can be a discrepancy now with how they feel their breasts look, because their overlying subcutaneous fat and breast has now deflated off the front, and the breast implant, well, that didn't see any weight change. So that is stuck right where it was 5, 10, 15 years ago, whenever that implant was placed. So all these considerations are taken on a case-by-case basis. With skin tightening options, the energy-based devices, the radio frequency, there's quantum RF, there's Renuvion. Admittedly, the laxity has to be quite mild for this to reliably raise the level of the nipple or raise particularly the breast. So this is used in very select cases. Whenever we are doing a breast operation, symmetry is obviously at the forefront of our mind. We have to do this not just right one time, we got to do it right both times. And if the patient has a larger areola, which is the pigmented portion around the nipple, we often downsize it or at least make it more harmonious in size with the surrounding breast volume. So this is an example of a breast lift or augmentation mastopexy with Galaflex support. Now, one of the things I talk to patients about is when you've lost, and she had lost 150 pounds, when you've lost all of this weight, the rib cage had expanded based on the former volume of fat that you have. So what breast implant volume may look like on another woman is not going to fit well for you. Your rib cage has a certain width. Your breast implant has to have a certain width. So at the end of the day, this is a higher volume breast implant because her friends who had this same volume, she felt, wow, they're huge, D, double D. And for her, I feel and she feels that it fits her frame well. I use the Galaflex support here because, again, if you're looking at her preoperative tissue and tissue quality, I'll, again, ask rhetorically, do you trust that skin to hold the breast implant in place? And if my answer is either doubtful or is questioning, that's when I'll reach for the internal bra. Now, for younger patients who lose weight, patients in their 20s, maybe early 30s, they feel like, well, I liked my breast before I had gained weight. We'll say in my early 20s, I gained a bunch of weight. Now I've lost some. I'm 28, 29 years old. Some of those patients can get by with a breast augmentation alone, as seen here. And I tell those patients in the future, just like all women, just like all men and women, the breasts are going to sag, aging is going to continue. But for now, we can revolumize back to when they preferred the shape and look of their breasts. To Sean's point, recovery. Everybody wants this to be like a microwave. You do it, you're done, and that's it. Well, no, the reality is the breast implants will sit high and firm and tight. The tissue will be swollen, and then it'll naturally fall into a more natural position. Some patients occasionally say, oh, I missed the swelling way up here by my collarbone. And it's, well, that's not really a natural breast appearance, but that's a different conversation. It also is the time for us to always counsel patients that, hey, the results you have on day one are not the results you have at 1 month, or not the results at 3 months, and to Sean's earlier point, not the results you'll have at 6 months. There's incisions, particularly when you're doing breast lift. They will continue to improve over time. Frankly, patients who have lost weight tend to have incisions that heal very, very well. This has been my experience, and that has to do with the elasticity or lack thereof, the elasticity and the presence of it on their skin. And implants, if they're placed under the muscle, will what we call drop-in fluff, meaning initially the pec muscle can be swollen. It looks funny. Sometimes we even call this Frankenboob. That's the colloquial term because it looks big and square. The pec muscle is swollen up top. The lower pole volume of the skin hasn't yet stretched to accommodate the implant, and it looks weird. But give it time. I'm sure any board-certified plastic surgeon will educate you appropriately. And then, like we've all alluded to multiple times over, the skin quality matters. This will affect how any result holds up. The reality is no plastic surgery, no surgery is permanent. The second we put that last stitch in, aging starts again from where you are now. So the goal is to reset the clock in a favorable fashion. The face. I know Dr. Michelon did an excellent job giving a primer, so I'll go through these things fairly quickly. As you can imagine, the skin is lax. Loss of subcutaneous and facial fat pockets results in hollowing of the cheeks, of the under eye area, and even in the buccal space. This also creates deepening of the folds and wrinkles from that expansion and now contraction process. A lot of this laxity tends to present in the neck with platysmal neck banding. Those are those lines that appear on your neck, which is a muscle that has gotten lax from its own expansion and contraction cycle. And this, of course, all comes together with loss of definition in the jawline, the formation of jowls with the marionette lines, and throughout the face. So this is a patient from 2 weeks ago, and this is her at 2 weeks post-op. She had lost weight in adulthood, and now started noticing the platysmal banding. So for her, we did a facelift, a neck lift. She wanted a more natural result, just to a refresh to where she was, how she felt her face had fullness before her weight loss. And we did fat transfer in through the face. Of course, now we're talking about doing her eyelids, which we often do at the same time, but her main concern was that loss of definition along the jawline and the platysmal banding. Recovery, recovery, recovery. I tell all of my patients at least 2 weeks for public appearances. Same way, if I gave you a blood draw and you get a bruise, that bruise might just hang around. The difference here is now that bruise is a big surgery on your face. So it takes time, at least 2 weeks, for that initial bruising and swelling to settle. Like all operations, the incisions continue to fade over 6 to 12 months. By any major life events, weddings, engagement parties, things like that, give it at least 3 months. But general social events, give it 2 to 4 weeks. It's normal to have some numbness in some of the areas where the skin has been elevated and tightened.
Now we're going to do a Q&A session, so feel free to drop all your questions in the chat box, or next to the chat box. It's the Q&A, and we will get them answered. For Dr. Michelon, is there a non-surgical way to treat sagging upper arms after weight loss?
So I think it depends on how much sagging there actually is. If you're talking about more of like crepey texture, I think there are some of those non-surgical options, the energy-based devices that can be used to get some improvement. But if there's more significant skin laxity, then you're probably more in the surgical realm.
Right, thank you. And then we have another one for pricing. I know that's broad, but if anyone wants to kind of give some insight for non-surgical and then surgical.
For non-surgical, it can vary greatly. The laser procedures that we do can be anywhere from $1,000 per treatment up to $4,000 or $5,000 per treatment, depending on the intensity. Other things can be added. Injectables will also vary from a few hundred to over 1,000, but it really just depends on kind of what is needed.
Well, I can talk about pricing
Okay.
surgical, even though I really can't. I think all of us on this webinar are very respectful of resources and like to be very honest and transparent with pricing. So for those of you who are entertaining something surgical, what goes into a surgical quote is typically a surgeon's fee, facility fee, and then an anesthesia fee. And in most cases, that incorporates all preoperative visits, all postoperative visits. It sometimes doesn't include garments and medications that we give you, that can vary. But these procedures are fairly substantial, and as much as they're transformative in people's lives, there is a cost to them. And so I really think it's nice when people start meeting a surgeon kind of during their journey and kind of make a plan for it. It doesn't have to happen in 2 months, and maybe it happens in a year, and savings can be done during that time. And then also staging things and separating them so it's not quite as expensive as doing too much at one time.
All right. Thank you, Dr. Doherty. Okay. How do you determine whether someone is better suited for surgical, non-surgical, or a blended approach?
I think I'll take it.
Okay.
When it comes to, my personal 2 cents, when it comes to weight loss, oftentimes extra skin is a core of the problem. To remove skin, you need an incision to remove that skin. There's no device that's going to contract the skin to a meaningful amount. Now, some of the texturing of the skin, some of the crepiness, we were talking about the arms a second ago for patients with very low BMIs who just don't like some of that early crepiness. Yeah, a little bit of, potentially some of the radio frequency devices can be mildly beneficial because they're only treating a mild, what we'll call a deformity. If you have enough skin that you could pinch a section of it together, all of a sudden, wherever your thumb and your index finger had pinched those 2 pieces of skin to bring them together, if you're doing that, you need a surgical approach.
Okay, thank you. What results can patients realistically expect with lasers, radio frequency, and ultrasound? Dr. Michelon?
For the energy-based devices, I think it's a modest improvement. And as Dr. Tandon said, if a patient is coming in and pinching, then that usually means that it's more, I would say, surgical, and I'd refer them to one of my colleagues for a consultation. So modest.
I think everyone here has to remember that weight loss, when it's done rapidly, which is what a lot of these GLP-1 medicines have created, your skin, it's great. Like, losing weight has substantial cardiac benefits, GI benefits, mental benefits, but your skin doesn't have enough time to kind of recalibrate and retract. And it virtually guarantees that there's a surgical intervention that's going to be recommended. I think when the best time to lose weight is when you're a teenager, because your skin has the ability to retract, and rarely do those teenagers ever need any body contouring from that. So we're really kind of behind the 8 ball when we're losing weight in our 40s, 50s, and 60s. And so I think it's inevitable that a surgical intervention is going to be required. But it's the combination of a non-surgical with surgical to help get the best benefits, and that is preparing skin for the best surgical intervention using non-surgical approaches, especially for the face, and then improving skin quality and character and scar treatments after procedures using multimodalities that Dr. Michelon was talking about.
I think adding to that, the non-surgical things that I do, the energy-based devices, are also are more like the fine-tuning of the surface quality.
Thank you. I saw one come in. Oh, common misconceptions, specifically for body. What are common misconceptions patients have about body contouring after weight loss?
I think some common misconceptions. Number one, I've lost 110 pounds. I've heard this from patients before. I had some body contouring operation 10, 15 years ago, and now look, it's loose again. They didn't take enough. And like I alluded to earlier, if you were happy, we'll say in the first couple of weeks post-op, that's what the surgeon, was able to do. So I want to make sure patients aren't disparaging their surgeons, are also not unhappy with results that I would hope you would be thrilled with. Like we talked about earlier, this elasticity is at every single cell. So just because we've removed this amount of skin doesn't mean all of the remaining skin also hasn't seen this amount of weight changes and didn't also contribute to some of the laxity you saw earlier. So that's one of the things I see frequently, particularly in the weight loss population. And then the other thing is breast implants need to be replaced every 10 years, like there's an expiration date. I hear patients, it's been 10 years. I'm happy, but I should get them swapped out, right? And I'm like, well, you should get them looked at, but that doesn't mean necessarily you need to just replace them like you change tires every, 10,000 miles.
We did actually have a question about the maintenance. So if there's anything else you want to add to that, Dr. Tandon, but specifically for breast results, how to maintain.
Well, so, as far as the, FDA recommendation, it's at 5 years following your augmentation. You should discuss having an MRI or an ultrasound every 3 years thereafter to evaluate the integrity of the breast implant. Particularly, a silicone gel breast implant. What we can say now is the rupture rates compared to the third and even fourth generation breast implants, it is substantially lower. I think the best way to remember it, if we look at the FDA summarized data, approximately 1% risk per year. Now, the newer devices actually outperform that, but to the best of our abilities, where we have the 10-year data, about 1% per year.
Thank you. And then going back real fast to one of our first submissions, they missed the beginning of the webinar. Sorry about that, but they mentioned brachioplasty, and if we already covered it, so I'm not sure if we want to give a brief overview, a quick little snippet. If you want, Dr. Doherty.
Sure. So brachioplasty is a surgical option for loose skin of the arms. Is a really bothersome area for people who have lost a lot of weight, but also for people who are just aging. That skin tends to age poorly, especially when closer to the armpit, and the crepiness and hanging of that is bothersome. So there are non-surgical and surgical options for that. Sometimes removing a subtle amount of fat and using radiofrequency to improve the quality and character of the skin can be quite nice. However, for patients who have lost a tremendous amount of weight and have tremendous hanging skin where it's sort of challenging to even wear clothing with sleeves, we're most likely talking about something surgical, and that's an incision that is designed along the arm, typically from the armpit to the elbow, and that really helps us sculpt and improve the overall circumferential shape of the arm.
See, go ahead, jump in. Yeah.
We were talking about kind of myths or kind of thoughts that people have with weight loss. And I think one of the things that I am sort of sad to remind patients about is that exercise doesn't always make things better. And when it comes to, say, let's talk about the abdomen, and I have patients who are presented with an abdominoplasty as kind of the correction of what's bothersome to them. And I think people are trying to kind of do lesser things, which makes complete sense. And they say, well, if I keep exercising and tone my abdomen, will this skin become taut? And unfortunately, exercise is not associated with more taut skin. I say exercising and feeling good in your body and getting healthier is always the answer. But if your direct goal is to create smoother, more taut skin, it's not always associated with that.
There was a thank you. There's a good one about breaking treatments into multiple stages. I know we combine a lot of treatments, but if someone, whoever, can talk about that, breaking treatments into multiple stages and safety. And
I think generally speaking, like we alluded to, these changes are everywhere. So to Dr. Doherty's earlier point, having your own priority list for which body parts you want to address is important. There are certain body parts that pair well together. Again, an upper bra line back lift combined with a mastopexy, because those incisions connect. Those play well together. Some doing, say, that operation with a thigh lift, now you're in disparate areas. As a sweeping generalization, outpatient surgery should be limited to about 6 hours. So the other thing is, these operations all have a long length of incision. You can imagine, just for a brachioplasty, it's this long of an incision. Both sides were out of the screen. Now you add a breast lift and an abdominal operation. It's literally, your wingspan of incision. I ask my patients, do you think you have the, metabolic resources and the fuel, so to speak, to have good healing in a robust fashion along that whole thing? Because I don't, and I'm going to cut off the operations at this point, because I think that that's what the human body can tolerate to be done well. Can it be done poorly in multiple body parts at once? Absolutely. But to me, this is elective surgery, and I draw the line where I feel like the patient's healing capacity, will be burnt out before it gets burnt out, of course.
Liposuction also plays a big role in our body contouring procedures. It's a really powerful tool that we have to improve your body, and it really has a profound effect on patients. And removing fat has a volume change on you. It affects your fluids, affects your ability to move and comfort level, and all that has to really be taken in context when considering your ability to recover, your resources for recovery, because everyone on this panel wants to keep you safe and have the best outcomes. So we're kind of hyper-focusing on the negatives here for a reason, so people have kind of realistic expectations and kind of know the good and the bad. But our goal is to keep you safe, and I think staging is really a very good option for a lot of patients.
thank you. Just a couple more, two more. Which procedures tend to create the most noticeable changes with the least amount of downtime? I guess this can be either surgical, non-surgical, one of each.
I mean, least downtime, an injectable hyaluronic acid filler, would be the least downtime. I think, as has been stressed here, the surgical options, whether you do a big surgery or a small surgery, all have, at least in my practice, 4 to 6 weeks of some form of activity restrictions. The non-surgical options tend to have less dramatic of an effect, but then therefore you have less downtime.
Tailoring off of that, this is our last one. How often can you get CO2, and can you do it on the chest?
So how often, I think the number of treatments would depend on kind of what the need is. And so then you could figure out a good timeline for that, because, indefinite treatments is not needed. And so, you could figure out the appropriate timeline and the number of treatments that would be expected. And then, Daniel, what was the second part of that question?
Let me go to it. Sorry. And can you do it on the chest or get it done on the chest?
Yes, you can. Yeah, it can be done on the chest,
And
off the face.
Dr. Martin, do you recommend doing both at the same time, or?
You can, and I have a lot of patients who do, face and neck combined, or neck and chest, or all three. So there are ways to do that. Yes.
Perfect. All right. Anything else, doctors, that you want to add on? Okay. Well, thank you guys, everyone that participated. We really appreciate you joining. Hopefully we can do more of these. I will send out a post-webinar email with information, booking links, the doctors specifically, their contact information, a little background, and we hope to see you in the office. So thank you and have a wonderful night.
Thank you.
Thank you.